Well, we are just a month into the school year. Is your child showing signs of behavioral issues, or might your child be having problems focusing on schoolwork? If so, help is here. Naturopathic physician Jared Skowron and author of 100 Natural Remedies for Your Child is back with us this morning with what you should look out for. Hi, Jared. Good morning. Thanks for being back here.
Hey, Shirley. Good to see you again.
All right, so the first thing, what are the signs that something is wrong?
Well, the first sign that most parents will get is a call from the teacher because there's some kind of behavioral issue, or the children are impulsive and they're not focusing, they're not sitting in their desk, and they're just doing whatever they want, and that causes trouble for the whole classroom.
All right, now studies actually show that if there's a lack of focus or behavioral issues, there's a direct link to academics and grades.
Well, exactly. I mean, if you can't focus in the classroom, you're not going to listen to the teacher, and if you can't focus on your homework when you're at home, your grades are going to suffer, and of course, our educational system just builds on the years before, so if you don't build a foundation, it's not going to help you for your whole life.
All right, so this is a very important segment for parents. Explain actually how the lack of focusing or hyperactivity might actually be genetic.
It is genetic, and it's the genes that control the brain that actually create the amount of adrenaline in our mind and in our body. Because if we have a lot of adrenaline, we don't want to sit still, we don't want to focus, and we're just ready to get out and jump around. So the amount of genes that affect adrenaline in your body directly affect your lack of focus, your impulsivity, and even ADHD.
And now there's actually a test for this. Why is it so important to get tested? And tell us more about what that test entails.
Well, it's important to get tested to understand how your child's brain and genetics are working. So we have a urine test that looks at the amount of adrenaline in your system, and we have a saliva test that looks at your genetics. And so we can piece it all together to see what your child has for DNA and how we can fix it.
Okay, and let's talk about how we go about fixing it. Let's give parents some tips here. Now, you say that there are actually natural therapies that parents should consider.
Yeah, and I really like the natural remedies that we use in our office because they're effective and there's no side effects to them. And so a few that we use, the first one is called GABA. GABA is actually a protein that acts in the brain to calm you down and relax you.
And again, this is to lower the adrenaline level in a child.
Exactly, that's the goal.
Okay.
So the first one's GABA. The second one is magnesium. Magnesium's very calming to the body. That'll also lower your adrenaline level. And we also use fish oil a lot. Now, one concern with fish oil is you have to take the appropriate amount, and a lot of kids don't like the way the fish oil tastes.
Yeah, you know, usually when you hear about fish oil, it's for an adult or for an older person. So how do you get your kids to take some of this stuff?
It's tough. They either have to like the taste of fish, or they have fish oil gummies out there, so kids can get a gummy, but the gummies are very low dose, so you end up have to take 5 or 10 gummies a day just to make that right dose to be effective.
And you've got the items here as examples on the table here we should tell folks.
Yes.
All right, now what about, aside from the therapies, there's also stuff that you can do in terms of monitoring your child's nutrition. So easy to make these changes.
It's really easy. What we need to do is make sure that we lower the amount of sugar in their diet. So kids are eating way too much sugar, the amount of sugar in corn syrup and sodas and juices we need to reduce. Give your kids some seltzer or make them some iced tea. The other thing we need to do is take out artificial food colorings out of our diet. Those are actually banned in countries in Europe because they directly link to ADHD, and we just have to stop eating those artificial colors.
2 quick fixes. Okay, Jared Skowron, thank you very much for your time this morning. Interesting topic.